Oh, I don't have to tell you it's live. The computer voice did. Good
Hmm.
morning, spectacular misfits.
Yeah, good morning. We are the
You
Spectacular
know,
Morning.
Misfits.
nice to see everybody.
Yeah.
Same here.
Uh, Byron, how do you feel today?
Oh, feel like, I know it's just a bit more experience and we just did that like last week, I feel like I have a bit more experience.
Do
I,
you
f-
feel prepared?
yeah, yeah. In the future, I'll feel more than ever. Yeah, we keep doing this in the future.
I know exactly how you feel. What's your goal for the podcast today?
The goal. The goal. It's just I thought we could just talk whatever things we want to talk about.
Yeah, fantastic. Arlen, how do you feel today?
I feel good.
You feel good? Good's not a feeling word. Dig
I
deep.
feel great. Great.
If this is my kindergarten class, we get hung up on that. Great's not a feeling word either. You look excited.
Yes, I'm
You
very
look,
excited.
Yeah, I bet we do. It's been like over a year that we actually did this.
Mm.
it feels like it.
Yeah.
Arlen, what's your goal for the podcast today?
Goal is to educate some good fellows about why America needs a universal healthcare.
Awesome.
Yeah.
Well, I feel happy to be here. I'm excited to spend the morning with you guys. It'll take my mind off of. I've had some anxiety over a background check that's hanging in the air that's going to make or break me getting a better job. So I'll get to take my mind off that for a little while. And my goal for the podcast is just to crush the first one, right? The first one's probably the hardest to some extent. Um, so to start, Arlen, why did you want to talk about universal health care in the United States today?
Well, because as you all know, I've lived there many years, studied there, and wanted to call it home, but then it's like you can't even get sick. What it feels like. Unless you somehow make it to the age of 65 or so without getting sick, you're kind of like locked into like the healthcare provided by your job. Or
Yeah.
if you're like jobless, then you're kind of screwed by yourself. So that's why I want to make sure that Americans actually understand that they're actually being ripped off and they deserve a lot more than what they're getting.
Yeah, I agree. I want to talk about why we deserve it a little bit more later. Byron, why'd you want to talk about universal health care in the United States this week?
Well, I did mention it's very important for this United States for a population of 340 million for of a population, yeah, of the people there. And well, since this administration, I mean, yeah, well, this budget of millions of billions of dollars USD, well, in the United States. Should well, I mean, I believe it extends that government intervention, regulatory spending, but it was did it unresponsibly, since billions have spent on the war and millions. Have you ever heard the news? Spent on crab legs and lobsters or whatever. That's
Yeah, I forgot we were going to make a comment on current events. When you bring that up, let me just say, being a mall cop and walking around, and I work in an affluent area. I'm not affluent, but the war has really brought out the worst in people, and especially old men. And again, I'm just talking about my affluent area because walking around, I hear so many old guys have now like come to life. It's almost like little kids playing army man. But a guy stopped me. He's like, you don't go to war to die for your country. You go to war to make the other guy die for his country. I'm like, okay, that's your feelings about this? Like they're all amped up because they're in no danger at all. It's just something like exciting that's
guy for other
happening.
country. Yeah. Well,
Yeah,
yo,
but
You
No,
can.
go ahead. Well, the reason I wanted to talk about universal health care, I'm lucky. I'm pretty healthy. My son's pretty healthy. Arlen mentioned health insurance being tied to your job. I have a real problem sticking with jobs. I've changed health insurance so many times just from jobs, and it always takes such an enormous bite out of the paycheck too. I don't really have any marketable skills, so my paychecks are small to begin with. And then, for me, it's not too bad, but then you add a dependent and there goes half the check. I finally, now that things are so expensive, I started going without. um I was able to get my son on a health plan, but a state health plan, but that's always kind of in danger. Um, so I just kind of ride this wave of I'm healthy and my plan is to stay healthy, but I see catastrophe all over the place. As a security guard, I came up to a homeless man rolling around on the grass, and he had kicked his shoes off because his feet were so swollen, like the toes were getting sucked into the feet. He's almost like a bubble drawing of a man that a little kid would do, and he's rolling around just writhing and suffering. I'm like, bro, I need to call you an ambulance. He's like, no, don't. I don't know if he thinks that, he's going to get stuck with a bill, or, the police are going to get involved and look into what he's got going on. I said, well, I either call you an ambulance or you got to walk out of here, because my job is to get him off the property. And I just watched him hobble away in misery. Because there's nowhere for him to go. He just can't get care. We don't provide it for some reason. And also at my mall post, there's a grocery store that does deliveries, and it uses a third party for that. And I affectionately call her the Amazon grandma, but there's a old lady hustling to pay the copays for her cancer treatment. Like I don't want to dox her, but she has an external medical device that's always attached to her, and she looks super uncomfortable while she's having to hustle and grind just to make her copays. So it's like, what are we doing? Why do we even have a society if people have to do this? Um, so Byron, you mentioned the cost. I looked it up, and it says the cost to bring universal health care to the United States is between $3 and $4 trillion a year. That's the most official number I could find. So let me throw that out to you guys if you want to talk about the cost. Like, is that a real cost? Is that what it would cost? How would it get paid for?
Well, United States, the debt so far, it's at $50 trillion increase, you know? Yes. 50 trillion. We have enough for it because the debt's been increasing. I don't know if it's $3 to $4 trillion is for the universal health care. I mean, I'm not wrong. I might be wrong on that, I guess. Maybe it could be hundreds of billions, I guess, or tens of billions. So I would say the answer.
I'm
I
I'm
would
skeptical.
agree. I
You'd
would
agree
agree
that.
with. I don't think it's 3 to 4 trillion because we have to take into account how much we're spending per capita already on healthcare, and still fail to cover everyone. So we have to take that into the accounting.
I'm skeptical of that number too. I mean, when you hear stuff like Byron mentioned, the Department of Defense spending the millions on the lobster, and you hear like the Iran war is going to be $1 billion a day, and you just hear so many like big numbers that they almost become meaningless. But
Yeah, this is from our taxpayer dollars.
right, like it's our money, and again, my brain is simple. It comes down to we live in a society where billionaires exist. They shouldn't,
Hmm.
but they do, and the reason they exist is because for some reason all of us who aren't billionaires don't go out and ambush them. So you know, a human's natural state is to live in a small group with other humans by a water source, and some of us are hunters and some of us are gatherers, and we work together to protect from bears, and that's how we live. But when we've decided to have a society, we've made this game board, and we're like, okay, we're not going to live in our natural state. We're going to do this other thing. Well, why does it only benefit some people, and then why do the other people just go along with it? Jeff Bezos can't exist. Elon Musk can't exist. Bill Gates can't exist. And we all aren't just going along with it. So we need to get something out of going along with it. So you're like, well, they became billionaires and you didn't. Why do you deserve it? Well, because we're playing by the rules. We're not burning everything to the fucking ground. So we need to get some bare minimums out of this arrangement. And the bare minimum should be that guy I saw whose feet are exploding and the grandma who's hustling groceries outside of the natural food store, like they need to be able to walk into a clinic and get their care. And what's it been, 2 decades since Michael Moore made that Sicko documentary and found out, yeah, with universal health care, doctors still lead a great life. They can still buy a fancy car. There's still revolutionary medicine and treatments being uncovered. All the naysayers saying, well, if the government takes over healthcare, it'll all go to shit. Like everything is shit.
Well, I mean, unfortunately, the United States has the first time has billionaires since the 1800s. John D. Rockefeller of the oil company, yeah, which is a true fact.
Yeah.
So propaganda is my opinion why it's just not popular. What do you guys think about uh where does propaganda come from that, you talk to somebody who would benefit from the United States having universal health care, but they'll argue against their best interest, like, nah, we don't want that. Where do you think this propaganda comes from? Why is it so effective?
I think it could be. Well, I can't believe we're in 2026 already. I'm much younger than you guys because I was a teenager like over a decade ago. I guess over a decade ago. Yeah, you seem to agree, Arlen.
I
Yeah,
definitely agree. I've been waiting forever and nothing's happened.
yeah, we're a decade ago of the Bernie U.S. presidential campaigns. Yeah, I
I
see
know
you
how
there.
that 1 decade is crazy.
Yeah,
Yeah,
Well, you mentioned Bernie, but Byron, I'm the oldest guy here. I
yeah.
remember when Hillary, well, during Bill Clinton's administration, Hillary was a champion for, I don't know if it was fully universal health care, but making health care more accessible to everyone. And a lot of the criticism of her came back like, "Whoa, why is the first lady getting involved with politics? She needs to stay in her lane and be more focused on the White House Easter egg roll." No, that's what she was hearing. But when she ran for president, that was the first time universal healthcare light was on the table. Um, but it wasn't received with as much enthusiasm as you'd hope. And it's just because the propaganda against is just so robust and effective, and I don't get it. You guys help me
I
understand?
I think I kind of get it to some extent. I think most of the propaganda is to please the pharmaceutical companies as well as the health insurance companies, because in like a universal or national healthcare system, um, we would completely get rid of the health insurance companies because it's seen as like a middleman that does nothing except gatekeep. So we get rid of them, and then people just go to the doctors directly, and the doctors are private. So it's not so like the whole talk about government takeover is not even true because hospitals are private, doctors are private. You just get to choose whoever you want to go. It's kind of like how single payer works, where the government is like the overseer of payments, and they set like certain drug prices so that like a limit so that can't go through the roof. But as far as doctors and hospitals, it's still private. So
Yeah, so I mean, it's really the people who would benefit just flooding the zone with a lot of noise, and
Yeah.
we used to get those like death squad, or you don't want your decisions being made by a by the government, but the government's death squads, and
And
well,
I just want the American people to understand those are all lies. They're complete
they
lies.
are absolutely. But guys, I was a social worker before I was a security guard, and uh, I the fringe places in Arizona I worked just have people who are staunchly conservative, and none of the messaging from progressives gets through that these things would benefit them. So, how do we bring down some of those barriers and make it a more popular idea that enough people would support? I mean, hopefully we still have elections coming forward. I'm not so sure. But how do we bring down some of the intrinsic or psychological barriers that are just so prevalent that people who would benefit are against universal health care?
Well, look, I know if like the population of the United States of the voters, I guess like a large majority are low information voters, I guess.
Hmm.
It seems that way. And well, the messaging has to be a populist messaging, and you have to appear on alternative media or yeah, alternative digital media. Yeah, yeah. And yes, to get more attention, no matter if I don't know, left wing or right wing. And you could also appear in corporate news media to get more exposure. Yes. And talk about the candidates talk about their political positions. I'm trying to think of the plan, trying to think of an idea.
Yeah, especially now that we're trending more towards state-controlled media, so it's going to be even harder to for our little ray of sunshine to poke through. Um, So yeah, I don't know how to get the message out. Like, hey, we really do need this. And we have to, the boogeyman of racism. I get my health insurance from my job. I don't want my taxes to be paying for, these immigrants who are here and would just walk in and get treatment that I'm paying for. How do you combat that?
Well, have to, again, it's all about messaging and education. And I think repetition matters a lot. You just have to keep at it because a lot of times I see a lot of Democrats, they talk about healthcare and then it doesn't work out and then like a decade of silence and then somehow it comes back. But you can't have a decade of silence. You have to keep talking about it. Even if you feel like you're talking to nobody, you have to keep talking about it until it's drilled into people's minds.
That's true. So yeah, repetition and being succinct. And I think you're right. I remember certain, I know we're progressive and not necessarily Democrat, but certain Democrats, Bill Clinton, Barack Obama, certainly Al Gore, they have good ideas that are just so big and technical, and they love, like, especially Al Gore, they love details. But then you lose people who can't follow all that. And the other side, the Republicans and now the fascists, are really good at packaging a message in just a handful of words.
Well,
I mean,
look,
yeah, go ahead.
any neoliberal politicians, these anything that's more like any technocratic messaging, it doesn't seem to appeal to ordinary citizens. They want something more uh what can relate to them and more populist messaging, yeah, yeah, yes. Any of
Well,
the
yeah, that's why Make
in
America Great.
policies. Yeah, and policies too. Yeah. Yeah,
We have to be meaner too. We have to be meaner to the opposition. We can't be like some of those corporate Democrats that sway back and forth. That does not work.
That's true. Yeah, the whole Michelle Obama, they go low, we go high. Yeah,
Yeah.
I mean, being nice, they kind of exploit that as a weakness. Um, and the people we're trying to reach, like, hey, you would really benefit from universal health care. You should get on board for, for you, your neighbor, your kids, your grandkids, and they're like, nah, sounds like a trap. That's not actually good. It's going to end up bankrupting the country, and it's going to benefit everybody else but me and my family. Um, but that's why Make America Great was so appealing to people. It's like, okay, my life is hard. Certainly not my fault. This guy and his crew want to make America great again. That sounds awesome. Great is so abstract in the mind of the voter. They can just make that to be whatever they want it to be. And then they start believing in it like Santa Claus. Um, but Arlen, you mentioned the opposition or the enemy. Yeah. So like the people currently in control of government who want to take our money and pocket it themselves, or go to war and get a global lobby together to turn the Middle East into casinos and resort destinations. Like, that's one enemy, but certainly the insurance companies are another enemy. Uh, what so what's the plan to start dealing with these insurance companies who are invested in not bringing universal health care to the United States? I mean, Luigi was one idea, but what's a more practical solution for dealing with the insurance conglomerate and the insurance lobbies?
Are you asking me or?
I'm putting it out there to both of you guys.
Oh, okay. Well, Luigi was definitely like a symptom of part of the problem. Like it was caused by the symptom of the problem, and it's too violent. So I'm definitely not for that. But insurance companies, they won't go away quietly. That's just the truth. So what we need to do is like get the voters to like pretty much wake up more to messaging, and then they will then vote for politicians that actually stand on their side and not insurance companies. Because the only way to get rid of the insurance company is if the politicians don't pocket money from them. If our politicians take money from insurance companies, then of course they're going to serve the donors and not us.
Right.
Well, look, any of these corporate Democrats voted in U.S. Congress vote against the Iran war. Well, they actually secretly supported that war, secretly, okay? No matter they vote against the Iran war, okay? I mean, they kind of struggle. Why did they vote against it? Remember the interviews, something like that, you know?
Yeah, I definitely get the feeling Republicans and Democrats are on the same team. I mean, if you just look at the the footage we see behind the scenes, they'll fight until the limo comes pick everybody up for lunch and dinner, and then they ride together, and they're all friends. A lot of them are friends, and some of the outrage is manufactured. But the Republicans these days can be outwardly evil. Uh, and then the Democrats come in and appeal to a certain group of people that don't want to be outwardly evil. So the Democrats feel like a safe choice, but their ideas are, evil light. Because like you said, the Democrats are getting paid by the same lobby groups Republicans are getting paid by. That's why we get what Chuck Schumer's strongly worded letters. We don't have who's leading the opposition right now. I
Well,
Can't believe he's leading the Senate. That's ridiculous. We need to remove him like immediately.
I mean, you got a guy who, like, well, I may be in the Epstein files 37,000 times, and the internet may be fluttered with legitimate non-AI actual pictures of my lifelong friendship with the most evil person we had. But no, I barely knew the guy. Like, what the fuck? Who's the opposition? Who's out there
Oh,
screaming every day? Impeach, convict, remove, put in prison. Impeach, convict, remove, put in prison. Like, why isn't somebody riling us up? And that's why I get mad at the big accounts on social media that just we all met on Bluesky, uh, but the big accounts seem to wake up. Oh, I'm gonna check Twitter for something that'll stir up a lot of outrage. Screenshot, and then they post it on Bluesky. Look at what the Republicans said today. Isn't it offensive? Get 10,000 upvotes, 1,000 reposts, cash in on being an outrage artist. But nobody big, be it in social media or the Congress, is saying income tax is 50% of the federal revenue. We need to start thinking of a general strike. Like, Rosa Luxemburg was right. She said the general strike is the only peaceful and effective tool of an aggrieved proletariat. We're all just shuffling. Well, we're gonna March 28th. We're all gonna protest on a Saturday. That's the best we can do to end wars and get universal health care is protest on a Saturday when nobody gives a fuck.
an anti-war protest. I think more people will engage in protest than no King's protest, I would say. I mean, that's what
Yeah,
most could agree on. And war is not going to benefit ordinary citizens. It's not. It's going to be more expensive to the government's going to pay, billions and millions of dollars. Yeah. I think,
billions of dollars, and that's why they'll turn around and say, "Oh, well, we can't afford universal health care. You know, national security takes priority."
yes. Look, this Iran war is considered to be the most unpopular wars in the United States. It's like in the mid-20s, even more unpopular than the Vietnam War. Yes, because they don't sit because they don't set up to do propaganda just like in the Iraq War that they took like years trying to set up a propaganda to make people motivated to go in that war. It was like in the 60s or 70s that they supported because they set up all that. There is no setup on that, and people seem to distrust corporate news media. Yes, you see now I think that's easy to polls there. And this is one of the reasons why the corporate Democrats voted against it. They know it was unpopular there, but even these politicians voted to fund the military, but they voted against the Iran war. But that doesn't mean, but you still vote the funding the military. Yeah.
And I
The
guarantee you, that
military is always used as an excuse to not give Americans anything in terms of social programs. It's
yeah,
pretty ridiculous that the U.S. got into Iraq and Afghanistan for 20 years, got out, and now we're back in the Middle East. It's like, what are we doing?
Well, yeah. I mean, this is like the fourth time already. In the Middle East region, from the Gulf War, Iraq, and well, Afghanistan is considered to be both South and Central Asia. I know it's one of those common mistake thought Afghanistan is in the Middle East, West
Mm.
Asia. Well, before that, it was in Far East Asia, World War II, Korea and Vietnam, World War II, Japan, yes. It was in the Far East before that, for the United States. Well, like in the Middle East, we fight against Israel enemies, Iraq and Iran, yes. Fight for them, because well, there's polls, like half of them believe this is well, I know people who oppose Trump. This is Operation Epstein Fury to avoid more release of the Epstein files, any more of that. And the other one, this is a war for Israel interests. Yes, those two motives there. Yeah, this is why not many people were motivated to go to war. And recently, there's like 5,000 ground Marine troops so far. Yes.
yeah. I mean, the whole engine of our country is malfeasance. When endless money for war, but universal health care, no, that's not even in the car.
I mean, I
Uh,
And
wonder
that's funny.
how will we spend for. I mean, we have the United States have 50 trillion USD. I wonder what we have to do with it. We need like to have a more strong social safety nets in the United States. There's one of them there. Maybe we should benefit other countries. You have 50
but
trillion
I
USD.
guarantee there's insurance guys right now, like in suits. How can we use everything going on right now to justify price hikes?
Well,
Yeah,
extensive government regulation of corporations. Extensive. That may control the prices there, yeah. I mean, also environmental protection. If you use renew sustainable energy, it does lower prices. Biomass, geothermal, yeah, biomass, geothermal, hydro from the dams, air from the turbines, and heat from the solar panels. Yes. It also create job growth and economic growth. Yes. All that.
Yeah, it's almost like all these things we could do would be profitable for the masses, and it would free up money for where the money should be going, which is the social safety net. But to lead us out of the war, I mean, it's all connected, right? It's all connected. That the corruption goes every which way, and war is an easy thing that the fascists can point to as that. Well,
yeah.
once we're at war, that's where all the money has to go, guys.
Yeah.
Conversation over. But to move away from the war, they also say there's a doctor shortage, and well, it's expensive because there's not enough doctors. And I have a real problem with that, but I'd rather hear from you guys first. We could pivot. We talk about the doctor shortage and just if it's real and as an excuse on why our private health insurance and our private pay is so expensive. It's a doctor shortage. Is
Well, I'm
it?
gonna get well, I'm gonna get sort of off topic. I mean, he can answer that question first, but I'm gonna get sort of off topic. Compared to Sweden, the size of California, almost the entire country is run by renewable energy. Nearly. Yeah, it's a social democratic nation. Nearly the entire country run by renewable energy. Yeah, it's the size of California. Okay, I already can answer that question when you when
Oh,
yeah.
this is about you guys because you guys are always like, it's so simple. I've been around a long time, and also, I mean, to some extent, it's true that after World War II, the United States built an incredible analog network of like phones and phone lines and everything wired, and we had all this stuff that other countries didn't have, and it was the cutting edge of technology at the time. And so countries
Mhm.
that didn't have that as a starting point were able to go digital and solar and do things that are more attractive today sooner because they don't have to rip out all the old shit. Ripping out old shit's expensive. So I mean that is a barrier, but it's not insurmountable, and it would be cost effective to do. But that's kind of a weak answer to, well, why do these other countries have it? Well, they didn't have the cool shit we had 40 years ago. Which how does that benefit us now? It doesn't, but it's a hurdle, a small hurdle, and it does get used as a nefarious excuse. But Arlen, doctor shortages.
Doctor shortages. I think you need to view because the U.S. is a big country. Um, as far as doctor shortages go, I don't think it's real in every single state. Perhaps it might be a problem in certain states, like underserved areas or like very rural areas. But like, I don't see a doctor shortage in big cities, to be honest.
You don't think there's an easy fix?
Well, I think doctor shortage, it's something that universal healthcare won't fix, like
Hmm.
outright, because even here in Taiwan, there are certain areas where there are some shortage of doctors. So this topic is yeah, it's harder to solve. It's not like if you create a fair system, it just automatically solves itself. But I do think if you give like doctors like a good life with balance kind of situation, it will like get newer students more interested in the medical field and join in and become doctors. That's one way to solve it, I think. And then the other way is just through education. Like I know a lot of people like to help other people, so you have to hospitals have to look out for those people more and recruit them, and they'll become potentially really good doctors. But I don't think it has much to do with the amount of pay because I know that like certain doctors in the U.S. make loads and loads of money, and there's still a doctor shortage problem. So
Yeah, Byron, do you have any thoughts?
Okay. Well, look, I met for doctors. I met this administration fire government workers there. I mean, this is gonna be a problem. They fired one or more. They were for professionals instead of hired some lackeys. I mean, this is not supposed to be a partisan thing or whatever, a loyalty thing. It's not supposed to be that.
Yeah, well, now you're getting into like now the landscape is intelligence and skill at that level is being punished because I don't want to go too far into why the administration pushes like anti-vaccine propaganda. Like we're so far from where we need to be that you know the official communications are arguing against good health practices, but just as far as the doctor shortage itself, I think it's also the commercialization of education. Like, and I don't want to, I want to out. My parents live in an affluent neighborhood, and I know some doctors, and I know their kids became doctors because they, their first purchase when they're making big money is a Porsche. Like, can there be a good doctor that's motivated by money? Yes. Can there? But two things can be true. Can there be a kid who went into medicine because he just wanted to make a ton of money? And yeah, it's also true. If you gave the opportunity for lower income people who just have a lot of compassion to go become doctors, we would get more good doctors. And they'd be there because they like helping people. And look, you need money to survive. Everybody needs money. Uh, why do we have money? Okay, there's a chicken farmer and he's got 200 chickens and he needs heart surgery, but the heart surgeon doesn't accept chickens as payment. So okay, money, middleman. I get it, but um, it's expensive to become a doctor, and if it wasn't, that would be more attractive to people with genuine interest in medicine and helping people. My kindergarten graduation, as the teacher, not as the kindergartner, I want to be a race car driver, but as the teacher, half the kids, police officer, doctor, nurse, those are the things that interest kids, and then unfortunately, the real world clubs them, and, they do other things, but I think if it was easier to not content, the curriculum needs to be very, very hard. Of course it does. But if it was easier to pay for medical school, I think we would get more quality doctors. And we would get doctors whose jumping off point wasn't, well, I want to be a millionaire plastic surgeon.
you're right. It doesn't help when students go into medical school just to come out um, thousands, tens of thousands in debt, and they can't pay it off until like
Yeah.
5, 6, 7 years later.
But again, the insurance companies make it unattractive too, because like, okay, you used to have 30 minutes with a patient. Let's make it 15 minutes with a patient, and you have to justify what you're billing for with all these codes, or you worked, or we're not going to reimburse you, or we're not going to reimburse your patient, and they won't come anymore. Like again, like you mentioned earlier, that conversation between patient and doctor gets muddled by the insurance companies. Um, but I've got something awkward but important to squeeze in. Uh, Downside, one of the maybe overlooked, but it's starting to become more noticeable downsides to the doctor shortage. is the rise of what some people are calling Noctors. Not a doctor, a Noctor. Uh,
What
tr
the
Traditionally, mid levels like physician's assistants and nurse practitioners uh, had an important scope where they could free up some of the physician time by handling smaller things. But because their education is so much less intense than doctors, but they do have some quality medical knowledge. They're being given more and more authority to practice independent, both by their own lobby, right? They want to be more independent, open their own little boutique clinics, make a lot of money, and the insurance companies are like, we don't want to, and hospital executives too. We don't want to pay a doctor's salary. Maybe instead of wasting all this money on five doctors, let's have one doctor and three nurse practitioners and two physician assistants. But now that we've been doing this long enough, it's coming out like, yeah, people are being harmed because mid levels without the same training as a physician are treating things they shouldn't be treating. And last thing
mm,
I'll say is, the if you pay attention to the advertising, like go see a nurse practitioner instead of a doctor. A nurse practitioner is what they say will listen to you. Now,
wow.
what that means is the nurse practitioner will just prescribe whatever you go in and ask for. Whereas a physician might push back and say, well, you don't actually need that. You need to do X, Y, and Z. A nurse practitioner will
Mm,
listen to you, which means they'll give you whatever you want. In a lot of cases, there's definitely good nurse practitioners who are bedside nurses and they continue their education, but there's a lot that came from a diploma mill, and now they'll listen to you. No, you show up and ask for something and they prescribe it. Um,
I,
have you guys noticed the rise of the Noctor uh, to fill the gap in the doctor shortage?
Well, look, I mean, so far, it's only, well, in modern U.S. history, it's only two U.S. president only does uh unemployment loss increase. Yeah, only does unemployment loss increase. Herbert Hoover and Trump. There's only two U.S. presidents, and there's U.S. presidents that does stagnant job growth from George H.W. Bush and his son. I mean, I know since the 1980s, so what's the percentage of how high the job growth is? The only one's high job growth was Ronald Reagan, and yeah, Barack Obama was lower than Ronald Reagan. The highest one was Joe Biden. Yes, because so far Donald Trump for twice in his administration only does job loss. I think that could be the answer. Say Noctors. Yes.
You're saying we have more Noctors just because it's the healthcare is the only area of growth and
Well, I mean, jobs. I mean, you have to get more. You have to increase the jobs. It's important. I mean, how can I get a doctor for that?
I see. Yeah, I mean,
So
because
far, the unemployment rates kept increasing.
yeah. Well, yeah, I mean, every time you turn around, you see more and more layoffs, and they're blaming it on AI. But yeah, it's like 40,000 people laid off. Well, they have to go somewhere. Unfortunately, until we get universal basic income,
Yeah.
they have to go somewhere. Yeah. Oh man. Uh, so I mean, what would the quality of life impact be across the country if we could get universal health care?
well, it would solve a lot like anxiety problem that America has because look, without health, how can you make wealth? Like even in let's just say in capitalism, don't isn't capitalism all about making money? How do you make money if you have a heart disease or if you're sitting there washing your kidneys or
Lower
you
prescription drugs prices.
yeah like laying there dying from cancer? Seriously. So the idea that healthcare is somehow socialist, it's nonsense. It's actually beneficial to capitalism as well.
That's a crazy thought. I hadn't occurred to me. Yeah, health. How can you make wealth without health? You know what, Arlen, you're a genius. Because remember, we said, how do we make a message simple enough that the low information voters would get it? I think that's perfect.
All right, I'll
How,
use that.
how can you make wealth without health? Yeah, you can't. I mean, look, I love, I love to complain, but I mean, my life's pretty good. But I was my degree is in journalism, and I worked as a social worker and a teacher, and I wouldn't call those physically rigorous jobs. I wouldn't, more intellectual work. But I've been a security guard now for only 9 months. I feel like I'm dying. Like it's so my legs hurt so much after standing for 12 hours. It's really given me some perspective. And again, like when I put duct tape around my legs because I couldn't afford compression socks.
Yeah, that's not right. That's not right. You shouldn't have to do that.
I'm looking at them in the pharmacy. I'm like, oh, $15 for compression socks. This is not bad. I'm like, wait, one sock? Maybe if I had one leg, I could spend $30 to alleviate my pain. That's 2 hours of labor. But if I could walk into a clinic and be like, hey, I'm in a lot of job related pain. I don't have health. I can't make any wealth. Like, oh, you need compression socks. Let's get you some. That should be the benefit of living in a society.
Yes, and you would think lacking something as basic as healthcare will get people angry enough to actually do a general strike and not like wiggle around on Saturdays.
People should wake up furious that we don't have this.
Like a bottle of like skin cream, let's say you have a skin rash. Why the hell is it that the same freaking bottle of cream in the US costs 10 times more than like anywhere else with universal healthcare? How can
That's
anyone
just,
not be angry about that?
I'm pissed off. And I have pretty good health. And luckily my son does too. And my grandma lived well into her 90s. Like we have good health in my family, but I'm still pissed off because I want everybody to have it. I want the Amazon grandma. I want the homeless guy rolling around on the ground with swollen feet. Like I want everybody to have it. And
Yeah,
if
that's the difference
somebody,
between us and like those makeup people, because makeup people are happy when they step over others and make others miserable.
yeah, it's like they can't feel good about themselves without somebody to look down on.
Hmm.
How do we? Hey guys, we're running out of time. How do we end on some positives? Where do you guys look to be inspired on the topic of improved healthcare in the United States? What's promising? What's going our way? What can people do? I don't know. Let's inject some positivity here at the end when it comes to our universal healthcare dream.
All right, I'll start. Vote in every single Democrat primary. Very, very important. Um, and have to research each of the candidates and see who actually supports certain issues, such as universal health care. I would say if they don't support something as basic as universal health care, don't vote for them. There will be a candidate that actually does support it. And if we do that long enough, we can reshape the Democratic Party into a more people-based party that actually represents us. And those politicians are more willing to actually look at other countries such as Canada or Germany, Japan, Taiwan, or any other countries that actually already have those systems, and they'll study it and make a system of their own that actually is um, very useful for the US, because every system has to be a little bit different because every country is different. But overall, the goal is the same: is to have universal healthcare.
Yeah, the world over. That would be nice. Byron, how do you stay positive on this topic? What are your ideas?
I do agree with Arlen idea. It's very important to vote in the primaries who are progressive, you know. Yeah, yes. You have to be more, well, as I think to this day, people are more politically active, more understanding of political science to this day. You know, doesn't mean the majority of them understand about political science. Yeah. I admit if any, well, any governor or a president of the United States pass universal health care, you could get very high approval rating on that. Yeah, like any other political positions that are popular to the to to the to the voters. Yes, you know.
I agree with both of you guys. But Byron, when you say that any president that sees it passed will have a high approval rating. I think, and I'll try to package this as a positive because we're trying to stay positive. But I think that's what scares some of the Republicans. They know once the population has something good and they see the benefit, it's hard to take it away.
Yeah, like
So
It is.
any
It's a political suicide.
any of these progressive populist economic policies, if it's passed, you get a very high approval rating. Any of them, you know, prescription drug prices, universal health care, universal basic income, livable wage, and etc. All
Yeah.
this, you know. Yeah,
all the stuff that we should have already in
yeah, that
2026.
other developed nations have, you know.
Yeah.
Yeah,
Or any, well, I mean, we have 50 trillion US dollar in the United States, the debt. It looks like we had to benefit our nations for, I mean, look,
Yeah. Yeah.
Israel relies on taxpayer monies, and they have universal health care, free affordable universities, paid maternity leave, and universal child care because our taxpayer monies of the United States. I mean, it has no
yeah.
natural resources there, and that's why they have that. Yes. Yeah. Yeah. Yeah.
All right. Let me
Yeah.
go ahead and check us out. Byron, how do you feel at the end of our first podcast effort?
Oh, that's and the first pocket effort. I
An
can meet
hour?
you any time in the future, you know? I could do this so, you know, every single, well, like every single Sundays, you know, whatever, you know? Yeah, dude, for feel more confident, you know? Yeah.
Nice. And how you gonna stay safe until we see you again next week?
So just keep myself safe, I guess.
How? You look both ways before you cross the street.
So, yes, always.
I don't
I
want to
mean,
feed
look,
you an answer. Everybody's listening. How you gonna stay safe? Make sure we see you again next week.
look, the United States should have public, free public transit, you know, instead of pay them. Government, they
All
should
right.
have that.
Arlen, how do you feel at the end of our first podcast effort?
Well, I feel good. I started out nervous, but yeah, I'm okay now.
Good's not a feeling word. I got you twice. And how are you going to stay safe until we see you again next week?
I'll stay safe by not eating in some small bite fancy restaurant and drinking wine.
For those, Arlen was at a upscale, upper crust event before he came in here. Byron and I just rolled out of bed.
Yeah, that was not worth it.
I feel, I don't know. Let's see. Relieved isn't the right word. I feel satisfied. I had a lot of fun. I noticed, I learned that, we got to train ourselves to tie ourselves to our topic at hand because as we want to go and solve crises all over the place. Uh, but we're working with a wealth of knowledge. So yeah, I feel satisfied, and I guess I'm the only one that's going to be in mortal danger because I work with the public, specifically the homeless population. So I will just watch my six and stay in touch with you guys throughout the week.
Sounds awesome.
All right, I'm gonna end. I'm gonna end. I'm gonna end it. We can.
Sounds good. Well, get together when we do.
All right. Send. How about Byron? You pick the next topic and send it to me and Arlen. Okay.
Okay, I had to think of it.
Sounds good.
He picked last week, so you pick next week.
Yeah. Okay,
All
I had to
right.
think of it. Yeah.
Thanks, spectacular misfits.
Yeah.
All right.